And in this moment, Darby knew that their friend was joking. So first things first, there are two different types of choking, partial and full. Partial choking can be identified by the patient still being able to somewhat breathe in and out, and possibly even still speak a few words.
Help!
If your patient is found to be partially choking, then encourage them to cough. A lot of the time, they are able to work the object they are choking on out on their own.
Keep coughing! Just keep coughing! Man, thought that was a close one.
Full choking, on the other hand, can be identified by a lack of verbal sounds or sounds of air moving in the airway. Some gagging or gurgling sounds, skin in the face turning red or purple, and possibly some cyanosis around the lips. This is also when individuals will flash the universal sign of choking, which is grasping their hands around their neck. If you suspect that someone may be fully choking, then first approach them from the front and introduce yourself.
Hi, I'm Darby.
Ask them if they need help.
Do you need help?
If they nod yes, then ask them.
Are you choking?
Most likely they will also nod yes. Next, ask them an open-ended question like,
What are you choking on?
this allows you to see if their airway truly is fully closed off or not. If they can respond verbally, then encourage them to cough. But if they can't respond to you verbally at all, then you can move on to performing emergency abdominal thrusts. First thing you need to do for your emergency abdominal thrusts, put one of your legs in between theirs so you are in a lunging position. Ask your patient to point out where their belly button is. Form one of your hands into a fist and start to wrap your arms around the individual's abdomen. Place your fist right above where they pointed out their belly button to be, and take your other hand and place it on top of your fist. From here, thrust your hands in and up into the individual's stomach in a kind of J motion. This is called a J thrust. Keep performing J thrusts on your individual till the object is dislodged or the patient becomes unconscious. But what if the patient is taller? Or shorter than you? Or they are pregnant? Or obese? And you can't get your arms wrapped around their abdomen? Then all you need to do is this. 1. For the taller individual, either get them to lower themselves to your level by spreading their legs apart or sitting in a chair. And for the shorter person, you can either lunge behind them or have them sit down to get them in the proper height range. Next, for anyone who is pregnant or obese, just move your arms up to around their chest, place your fist in the center of their chest, and instead of performing J thrusts, just thrust straight back till the object is dislodged. To perform emergency abdominal thrusts on an infant, pick up the infant and straddle them on your bicep, pinning their leg to your ribs. Next, kneel on the ground and position the infant with their head down below their body. With the heel of your hand, deliver 5 back blows in between the infant's shoulder blades. After that, rotate the infant over onto their other side, making sure to keep their head below their body. Find the center of their chest and perform 5 chest compressions. Once that is complete, look in the infant's mouth for an object. If you see an object, you can use your finger to try and sweep it out. If you don't see anything, then we never do a blind finger sweep. We can push the object lower into the airway. Continue cycling through back blows, chest compressions, and checking the airway until the object is dislodged or the patient becomes unconscious. If at any time while performing emergency abdominal thrusts on any patient they become unconscious, simply help guide them or lower them to the ground and start CPR.
Oh man, that was close. You saved me and all those people's lives. Thank you.
No problem. Just be careful with those marshmallows in the future, alright?
And in this moment, Darby knew that Darby was choking. It is possible to do emergency abdominal thrusts on yourself. All you need to do is find a sturdy structure like a back of a chair, toppled over a tree, or even a rock. Align that object with the top of your belly button and throw yourself onto it. This creates the same action as someone doing J thrusts on you. If you don't feel comfortable throwing yourself onto objects, then you can also just find a stable wall, sit yourself up against it, place your hands on your own abdomen in the same way you would for emergency abdominal thrusts on another person. Then perform J thrusts on yourself.
Oh man, are you okay? Yeah, I'm okay. Let's just stay away from solid food for the rest of the day. Sound good? Yeah, sounds good. Man, I've never seen so many people all choking in the same place at the same time. Yeah, it's like we're in an instructional video about choking or something. Nah, that'd be weird. Yeah, you're right. That would be weird.